Hello everyone, welcome back to my YouTube channel. So myself I am Mansa. So today my subject is biology. Today my topic is heart as a pump system. So let us see like human heart. Introduction. So human heart is a four-chambered muscular organ. The human heart is very strong and is capable of pumping blood up to 30 feet distance. An average heart beats maximum of 70 to 80 beats per minute and is considered healthy. The heart is called a double pump because each side pumps blood at different circulations. So deoxygenated blood pathway. So here body to superior or inferior vena cava and right atrium, tricuspid valve, right ventricle, pulmonary valve and lungs. So oxygenated blood pathway. So next this is a key functions of the heart as a pump system. So generating pressure to move blood and maintaining blood flow and regulating blood volume and ensuring unidirectional flow and where the heart's value prevent the black flow of blood ensuring it moves in a single direction. So we can see here it is a diagram of a heart and yeah, coordinating with the vascular system and last is integrating with the endocrine system. So next, anatomy of the heart. So the heart is a muscular organ located in the chest cavity. So it is divided into four chambers. So this heart is divided into four chambers, that is left and right atrium and the left and right ventricles. So next, the heart is responsible for pumping blood throughout the body and delivering oxygen and nutrients to cell and removing waste products. So in this diagram here we can see that there is a left pulmonary artery and left pulmonary veins and there are fat and vessels in coronary skulls and coronary sinus and their left atrium and superior vena cava. So next is architectural features of the heart. So the heart has a unique architecture with thick walls composed of cardiac muscle tissue and valves within the heart ensure that blood flows in the correct direction, preventing backflow. The coronary arteries supply the heart muscle with oxygen-rich blood, supporting its continuous function. So here we can see this is the architectural features of a heart. So next is chambers of the heart. There are four chambers like this: right atrium, right ventricle, left atrium, and left ventricle. So in right atrium, deoxygenated blood from the body enters the right atrium. This blood is under low pressure. Next, right ventricle. So this blood passes into the right ventricle, which contracts to pump blood to the lungs, where the blood is oxygenated. So next is left atrium. So oxygenated blood high in O2 from the lungs enters the left atrium. This blood is still under low pressure. So next is left ventricle. So oxygenated blood enters the large left ventricle which contracts very hard to push and the blood into the rota. The left ventricle is very thick and generates a high pressure pump blood around the whole body. Then this is the chambers of the four chambers of the heart. So here we can see this is a diagram of a heart. So next electrical signals ECG monitoring and heart related issue. So here introduction to ECG monitoring. So electrocardiography is a method used to record the electrical activity of the heart. ECG monitoring helps in diagnosing various heart conditions by analyzing the pattern of electrical signals. So it is a non-invasive procedure that provides valuable information about the heart's heart. So ECG monitoring is crucial in detecting abnormalities in the heart's rhythms and structure. So next, basics of electrical signals in the heart. So the heart's electrical system controls the heartbeat by producing and conducting electrical signals. The sphenoidal node generates the electrical impulse which then travels through the atria and ventricles. So the ECG graphically represents these electrical signals as waves and intervals. So next is the components of an ECG. So ECG uses the grid system to visualize the electrical activity of our heart. So the grid has two axes, that is horizontal and vertical. So the P wave represents vertical depolarization and the QRS complex signifies ventricular depolarization. So the T wave indicates ventricular repolarization. So next, let's see importance of ECG monitoring. So ECG monitoring is crucial for early detection of heart conditions, and it helps in monitoring the effectiveness of heart medications and treatments. So ECG can aid in risk assessments for cardiovascular events. It's the future of ECG monitoring. So advancements in wearable ECG devices allow continuous monitoring outside healthcare settings. So artificial intelligence is being used to analyze ECG data for more accurate and faster diagnosis. So this ECG monitoring it is also used in hospitals. So heart related issues. So let's see what are heart related issues. So heart disease is a term that covers condition affecting the heart structure and function. So common types of heart disease including like coronary artery disease, heart failure and arrhythmias. Next, risk factors for heart disease including high blood pressure, high cholesterol, smoking and diabetes. So yeah, some of the heart related disease that is coronary, that CAD, and that is high blood pressure, heart failure, heart value disorders. Next, congenital heart disease. So next is the reasons for blockages in blood vessels. So what is the cause of blockages of blood vessels? Generally, the blood flow is obstructed due to external factors like it may be calcium deposition, plaque formation, or the presence of dead cells that near the walls. So all these are credited to improper diet and lack of exercise obesity. So blocked arteries are usually caused by this condition occurs when fat, calcium, cholesterol and other substances build up in our arteries, the blood vessels that carry blood throughout your body. So let's see the what are the reasons for blockages of. So first one is obesity, like due to diabetes, high blood pressure, smoking, high cholesterol, sedentary lifestyle, aging, alcoholic beverage, blood clots, next heart attack, next sleep deprivation. So next is foods that maybe clear the blocked blood vessels. So first is six active cleansing foods for a healthy heart. So omega-3 fatty acids, garlic, pomegranate, lichen, turmeric and vitamin C. So next is how can we reduce this blockage naturally? Like do not smoke or use tobacco, limit or do not drink alcohol, control blood pressure, cholesterol and diabetes, exercise and stay active, maintain a healthy weight, eat a low fat, low salt diet that's rich in fruits, vegetables and whole grains, and reduce and manage stress and get sleep for up to 7 to 9 hours daily. So next is design of stents. So function. So let's see function of stents are small expandable tubes used to open up narrowed or blocked blood vessels often used in corneal heart rest. So next, so let's say design considerations. First one is material. So Biocompatibility is crucial. Common materials include stainless steel, cobalt chromium alloys, and shape memory alloys like nitonin. Drug-eluting stents release medication to prevent re-narrowing. Next is structure. This stent must be strong and flexible. It is often designed in a mesh pattern to provide support and allow for expansion. Development mechanism. Stents are delivered using a balloon catcher. The design must ensure that the stent can expand appropriately and stay in place. So next is surface coating. To reduce thrombosis and restenosis, stents may be coated with drugs, polymers, or other materials. So next is pacemakers. So what is the function of these pacemakers? They are electronic device that regulates heartbeats by sending electrical impulses to the heart. So let's see design considerations. First is power source. So long-lasting, reliable batteries are essential. Lithium iodine batteries are commonly used. So next is circuit design. So low power electronic to generate and regulate the electrical impulses. So next is leads and electrodes. The leads must be biocompatible, durable and capable of conducting electrical impulses effectively. So they must be securely attached to the heart tissue. Next is programming and telemetry. So pacemakers must be programmed to adjust the pacing rate and other parameters. So next is biocompatibility. The device causing must be biocompatible to prevent rejection and minimize the risk of infection. So next is defibrillation. So this is function. So defibrillations deliver a high energy shock to the heart to treat life-threatening such as ventricular fibrillation. So next is design of this. So energy storage. So capacitors for rapid charge and discharge cycles to delivery shocks. Next is detection algorithms. So advanced algorithms to accurately detect and determine shock timing. So next is electrodes, designed for efficient energy transfer while minimizing tissue damage. Next is size and weight for implementable devices minimized for patent comfort. Next is these devices require continuous innovation and improvement to enhance their performance, safety, and patient outcomes. So, collaboration between engineers, medical professionals, and regulatory bodies is essential in the development